Hi, I'm Nicole Blitzer. I'm a nurse at Physical Medicine and Rehabilitation at Penn Medicine, Rittenhouse. I'm here today to talk to you about radiofrequency ablation. If you're watching this video, you and your doctor have chosen radiofrequency ablation as the next step in your treatment. We want to make sure that you have all the information you need moving forward with this procedure. Feel free to watch it as many times as you would like. Radiofrequency ablation, or RFA, is a three-part procedure which will be completed on 3 separate visits. The first 2 visits are for the diagnostic injections. These are done to confirm the pain-generating nerve and determine if you're a good candidate for the ablation. Your doctor will use X-ray imaging to help guide a fine needle to the location of the suspected nerve and then deliver a dose of numbing medication through that needle. If both of these procedures are positive, which means you should get a handful of hours of pain relief afterwards, you'll move on to part 3, which is the actual radiofrequency ablation. The ablation is done to burn the nerves identified in the diagnostic procedures to prevent them from sending a signal to your brain, which it interprets as pain. Again, using X-ray imaging guidance, your doctor will place a probe along those nerves near your spine. The probe emits radio waves that ablate or burn the nerves that are causing the pain. To be clear, these nerves do not control the muscles in your arms or your legs. They do carry signals from the small joints in your spine, called facet joints, to your brain where they are interpreted as pain. When you come in for each of your diagnostic procedures, you should be experiencing pain that you would rate 5 out of 10 or more. If your pain is not constant but caused by something specific like walking or movement, you should be able to reproduce the pain for your procedure. This is important because it helps us measure the success of the procedure. A positive result will mean that your pain decreases immediately after the procedure and for the first several hours. Since we only use local anesthesia or numbing medication, we expect it to wear off by evening. We ask that you record your pain level every hour for the first 6 hours only after your procedure and send that information to your doctor via the My Penn Medicine portal. The diagnostic procedures take 5 to 10 minutes and the RFA takes 30 to 45 minutes. However, you should prepare for your entire visit to last 2 to 3 hours. After the RFA, some patients experience temporary flare-ups or muscle spasms. Don't worry, this is normal. It's helpful to apply ice at the injection site after the procedure, and you can use the pain medications that you were previously taking if needed. While it may seem counterintuitive, pain relief may not be noted for up to 3 weeks. This is because it can take that long for the nerve to completely lose its ability to send pain signals. The relief you get can last for 10 to 18 months. Half of our patients report lasting relief. After your ablation, you'll be instructed to limit heavy activities for 1 to 2 days, but you may continue with normal activities. You should have someone drive you to the procedure and from the procedure, and should not resume driving until the local anesthesia wears off. You'll be awake for the procedures because your doctor will need to communicate with you. If you have questions or concerns about this, you can request medication for anxiety at the facility where your RFA is being done. Better yet, talk to your doctor about your concerns prior to your procedure. If you find you still have questions, please send a non-urgent message through My Penn Medicine where we will respond shortly thereafter. If you've not already activated your My Penn Medicine account, please give our office a call and our staff will be happy to send the instructions to the email listed in your chart. Thanks so much for taking the time to watch this video about your radiofrequency ablation. See you in the office soon.